Hello, this is Dr. Do again. This video is still on alphabetic list problems on letter S. Today I'm going to talk about the stones in the organs, and you know it probably, the gallbladder and also the kidney, and sometimes the pancreas also can have stones. And there's another stone can occur in the eyelid actually. It may not happen, but may not quite commonly happen, but it may occur in those people who had a problem to metabolize lipid or obesity. The stone can occur in the eyelid. Actually, those are just these are the major organs I can think of stone can occur. Actually, I mentioned when I talk about kidney disease, I talk about the stones, and when I talk about the gallbladder disease, I talk about the stones. Basically, it's just to put everything together, wrap it up. So let me just first bring up the emergency situation associated with this either gallbladder stone or the kidney stones. Usually, when the stones are in the gallbladder or in the kidney itself, it's probably symptomatic, until the stone dislodged and stuck in the ureter or in the bile duct or in the pancreatic duct. If that's the case, that's really the emergency situation because of the pain. And also if it's not treated in time, can cause a serious problem. For example, the gallbladder stone. You feel, if it is stuck in the bile duct, you feel right upper quadrant pain, colic pain, very serious, and nausea, vomiting, may or may not have fever, may or may not have jaundice, but that's still it's emergency. Particularly, a lot of time happened after a large meal with a lot of fat, a large fatty meal, and develop this right upper quadrant pain. That's emergency. Of the same idea for the kidney stones. If feel the lower abdominal pain, colic pain, nausea, vomiting, sometimes even can have blood urine. If that's the case, the pain is really intolerable, either one. So to see the emergency room, and if the stone size is small, the physician you'll be given some dilator to open up the tube to pass it by itself. If it's bigger enough, has to be either the wave ultrasound to crush it, or through the scope to take them out. But anyway, these are the emergency situation. And in terms of the pancreas, the similar, I think that they share eventually the same idea for the symptoms, just the location probably instead of the right upper quadrant, probably the middle abdomen, upper middle abdomen pain, colic, and regardless, it's also emergency. And the stone in the lithium is in the eyelid. It's really it's just like the acne in the, not the same idea, the gland, meibomium gland in the eyelid. Sometimes reach of those lipid components start to be thickened and to clot the eyelid. You feel a little bump. That's if you went to the physician, either your primary care or your eye doctor, they use the tweeter or something to squeeze it. It's like a little, not very soft. Sometimes it could be a little relatively in between the hard stone and the soft lipid. So that is also can happen. So this is about the stones. And in terms of the component, the risk factors, hypercalcemia, which means increased calcium in the body, and also other component of an amino acid metabolites are not in normal form, or uric acid elevated, like the gout. They all can have the risk for the stones. In terms of the preventive of, I think because the stones, in addition to the calcium elevation, also associated with the lipid, cholesterol. So those hypercholesterolemia increase the risk of the gallstone. So if that's the case, start from the fundamental, decrease the blood lipid, decrease blood cholesterol by eating healthy, exercise, and also for the gout. I think if you previously diagnosed with the gout, your physician probably told you to monitor the uric acid regularly. you probably know it. The uric acid usually it's normal, but for those who had gout may elevate it in general. But the fluctuation of uric acid is really cause a symptom, because this elevated uric acid increase the risk of the stones. And also for those people, probably your physician already advised you to take allopurinol to prevent it. In terms of kidney stones, the many risk factors like acidosis or chronic kidney disease or infections, or increased calcium level, or increase some hormones like parathyroid hormones, for example, those are all the risk factors. So if you have previously kidney stone history, or you have family history of kidney stone, and I think drinking fluid is one of the method you can do at home to prevent the stone, because dehydration really condenses the component and make the stone easily to form. So if you rehydrate, the kidney will flush them out. For the small one, they're not going to congeal a bigger one to stuck in the tube. So that's probably. And also if you have chronic kidney disease, like the tubule disease, acidosis, or the endocrine disease, like the parathyroid hormone abnormality and the phosphorus, for example, the levels are different or elevated. Anyway, so if you had those, your physician probably advised you have increased risk for the kidney stones, and just monitor and drink fluid. And also if you have symptoms for this, you suspect probably it's stone, you need to see your physician. And for those, I know the chronic kidney disease, this is quite challenging, because chronic kidney disease, the water intake or hypertension, the water intake is limited. If that's the case, I think you need to talk to your physician, give you some medication to change the urine pH or change the urine component to decrease the calcium precipitate forming the stone. So if that's the case, it's, some medication can manage the blood pressure at the same time prevent the stone formation. So if that's the case, it's one stone for two birds. Probably it's not, but it's just if that's the case, your physician, talk to your physician, you can bring that up. I had family history of stone, or I afraid I might get the kidney stone. Use some medication, then can treat your hypertension, benefit from your kidney, and also prevent the stone. So this is about, in terms of the gallbladder stone, I think majority of the case it's just occur in those overweight or obesity patients. So if you know that, if you had family history, or if you have past history of that, you probably need just pay attention to decrease, try to modify lifestyle to decrease the risk. In terms of treatment, if the stone bigger enough, has to be treated with the surgical or the ultrasound, the wave, extra corpus wave therapy, to break them down and to let them pass either bile duct or pass the ureter. So this is about the stones. Basically, I think I have talked about that before. Just think about to put kidney stones and gallbladder stone together. And I hope it helps. By the way, Thanksgiving is coming, and that's probably increase the risk for the gallbladder stone. I had previous cases after Thanksgiving, after Thanksgiving meal, went to the hospital for the gallstone. So let's remind you. I'm going to stop here today, and thank you for watching. I'll see you next time.